Thanks for that introduction, Colleen, and greetings wherever you are, and welcome to another episode of the Dry Face podcast. Thanks as always for listening, watching, and sending your feedback. This is our 52nd episode, and as usual, we have a very exciting package for you today, which I'm sure you will enjoy. So, today we are going to talk physiotherapy or physical therapy and the return of sport in the Caribbean. But before we get there, let me remind you to hop over to our YouTube channel. Please remember to subscribe, to click the notification bell, do all of those lovely things as I always say, as the influencers ask you to do. Also, we're on social media. We're on Twitter at the Drive Phase GA, Instagram and Facebook. We are the Drive Phase. So please go over to those and like, subscribe, all the lovely things over there. All right. So to discuss this topic today, an area of physiotherapy in general, I have physiotherapist Marita Marshall. And Marita is born in Barbados. She's a Bajan, she'll tell you. She holds a BSc in physical therapy from Mona campus, that's UWI, and a master's in sport and biomechanical medicine from Dundee University in UK. Her specialty is sports rehabilitation, and she'll talk a little bit more about that. And she has a keen interest in public health and women's sport. She has also served as physiotherapist for Cricket West Indies women's team, as well as other teams representing Barbados. Marita, welcome to the Drive His podcast.
Thank you so much for having me. It's a pleasure to be here.
Listen, really pleasure having you. The first thing I want to ask you is, what is physiotherapy? Now, this sounds like a very simple question, and I'll tell you why soon, but just tell us, what is physiotherapy and what do physical therapists do?
So, physical therapy is the practice of rehabilitation using physical methods, in that we do not administer medication, we do not give injections. Everything we do is on the surface. We treat by using manual therapy techniques, by doing massage, by using exercise as a tool to get through rehab, to manage pain. So everything we do is physical and pretty much on the surface. And physiotherapists are persons who work with people who might have pain, injuries, basically to be able to get them to return to their previous level of function. So if it's an athlete, it is going to be to return to their sport. If it is, I don't want to say normal person, but yeah, a normal person, then obviously their goals will be a little bit different. So if it's to return to gardening, perhaps, then that's what we work with persons to do.
Right. All right. So help me out here and my listeners and viewers, the difference between what a physiotherapist should be doing versus a massage therapist versus a physical trainer. Because I find
Right.
sometime in the Caribbean that you may have a massage therapist doing things that I'm assuming a physical therapist should be doing, etc. Let me just end there and turn
Yes.
over to you.
Yes. And like you said, in the Caribbean, those lines can be very blurred. Unfortunately, I would like to see everyone be able to work together and work within their particular roles, and not, yes, in some areas they overlap, but we respect each other and respect the boundaries within each profession. So a physiotherapist is qualified to assess, diagnose, and treat. A massage therapist is not. Physiotherapists do also do massage. In most cases, they may not necessarily focus on therapeutic massage, which is that general massage that you would do to get just relaxation. So your massage therapist or masseuse would more so deal with that. There are um, different massage therapists who may qualify to do sports massage, but massage therapists generally aren't qualified to assess injuries or to assess persons with pain or anything. So your massage therapist is I mean, yes, they will have an idea and they have training in and knowledge in anatomy. But in terms of assessing and making diagnosis, a massage therapist is not qualified to do that.
Yeah.
No, you said personal trainer or a therapist, because
Well,
those are two.
physical trainers.
Right. So physical trainers, no, are kind of similar to strength and conditioning specialists. Those are the persons who will take an athlete after their rehab is completed and get them ready again to perform. So they're the ones who are going to get them doing more maybe explosive exercise and movements and stuff like that. And they focus solely on exercise. Again, they're not qualified to assess, diagnose, and treat in terms of injuries and pain. So that's where the physiotherapist comes in. And the physiotherapist has wide knowledge in terms of understanding injuries and understanding the rehabilitation that is required for an injury. The other two specialties do not.
Okay. And then my follow-up question is then why did you decide to become a physiotherapist, and kind of what the route was for you?
For me, I always knew I wanted to be in the medical field. So I guess that was easy. Initially, I actually wanted to do medicine, but I changed my mind from that. And I was always involved in sports. I used to swim, and I kind of had an idea of physio through sport. And I did a little bit of research. I had to do some volunteer hours at a hospital to be able to apply. And then after doing the volunteer hours, that's when I really realized that, there's a lot more to physio than what most persons are familiar with, which is sports physio. And I saw it as something that I could definitely get into and do and enjoy. So yeah, that's pretty much how I got into it. And then yeah.
No, Marita, all healthcare providers are at risk for exposure to COVID-19, whether in the workplace, in communities, etc. For you, what are some of the precautions that you have to take now as you look to treat athletes, officials, and just people in general?
Yeah, well, wearing PPE is for sure the first thing, you know. As you know, you have to wear your mask, you have to wear your face shields or goggles, whatever you choose to protect your eyes. And then another measure is also gowns, from in certain instances gloves. So personal protective equipment is definitely something that we've all been exposed to at some level, even if it's just wearing a mask. So that's one thing that for sure we've had to implement to protect ourselves from COVID-19.
Mm.
It's become the norm.
Yeah, I thought though, since the Caribbean is looking to get sport going again, in some spaces we're still having no training, etc. But by and large, especially with the Olympics approaching, a lot of athletes are trying to start training, get into competition where possible. What are some of the things athletes and officials probably need to look out for as we look to resume sport in the Caribbean?
I think these basic measures, of wearing a mask as much as possible, making sure you social distance as much as possible, making sure that you sanitize and wash your hands as frequently as you can, and just try to minimize any exposure that might put you at a higher risk of contracting COVID-19. So, if you're looking to travel or head out to competition, then you might not necessarily go liming by friends, or putting yourself in situations where you could have increased exposure and increased likelihood of contracting COVID-19.
Yeah, how difficult or challenging, I suppose it is now for physiotherapists in terms of treating athletes, keeping in mind that some may not have been training or exercising or stretching as they should be, etc. What are some of the things that you're seeing or some advice you'd give to other physiotherapists out there?
Yeah, I think during the entire pandemic, I saw it as a period where us as healthcare professionals could really, try to educate our athletes and persons in general, because people have been locked up, unable to exercise as they, would have been used to doing before. But in more importantly for our athletes, and professional athletes, it's been particularly hard for them because they have not been able to train in some instances at all. Um, so it's really just about when you're returning to training to make sure that that is done in a gradual fashion, that, they say injuries happen from doing too much too fast, right? That is bottom line. It sounds simple, but it's the truth. And yeah, athletes have to just, yes, you're eager to get back into training, but have to remember that you weren't doing anything at all for months or weeks to get back into training.
Right. Well, that's a good one, Marita. So it must be a challenge then for athletes who want to really get into competition to try and figure out their bodies, try and work through the different challenges, etc. Let's give two scenarios. What advice or how would you approach an athlete one who had tested positive and is recovering and wants to get into training? What would be your approach with that athlete if for example you have to treat them for any reason? And then the second athlete is the ones who are looking to get to the Olympics and looking to get into training. What are some of the things that you probably want to tell them to look out for?
Again, COVID-19 is here. It seems to be here to stay. It's not going anywhere for now. So definitely those protocols have to be adhered to. You really have to make sure that you are on your P's and Q's in training during travel. And then, like I said before, in returning to training, making sure that you have gradually return to training. Make sure you take note of how much you're doing in whatever aspect it is, whatever sport you're in. And for an athlete returning to training from being COVID positive, I mean, this is no longer taboo. There are many athletes who've tested positive, many persons who've been through it. And once you've gone through all the testing and you're no longer positive, then it's really just about, again, getting back into things gradually. Um, there has been, a few statements saying that, persons have had issues in terms of breathing and stuff after being COVID positive. But again, you make sure you stay in contact with your doctor, your physiotherapist, and make sure you take guidance from them if you have any difficulties after returning to sport from being COVID positive.
Mm. Let me ask you, since you have traveled with teams, including Cricket West Indies, you've traveled with Barbados teams to competition. If you were selected for one of these teams, what would be some of the things you'll be asking the NOCs to bear in mind going into these games, whether it's related to COVID-19 itself or just injury management and injury prevention for athletes?
Um, Well, since we talked on COVID, I mean, traveling during COVID and traveling in this new circumstance is something that's very different. The likelihood of getting respiratory tract infections prior to this COVID world was high for athletes, and that's always been a time, just from getting on a plane, you're at risk of having some kind of, picking up some kind of flu, cold, some kind of upper respiratory tract infection. And now with COVID-19, it's even more important to make sure that you really sanitize, you really, literally keep yourself as clean as possible, keep yourself away from people as much as possible to ensure that your journey, you can make to the next place safely. And having to change flights and stuff, it's traveling now is a lot more difficult and there are a lot more risks, but it can be done safely. And I would say for sure NOCs have to put a lot of um a lot of emphasis on that, because I think now that things are, easing up a bit, people are thinking, they can, relax a bit, but no, we can't relax because COVID is still out there, and
Mm.
you do not want to be training for months and then unable to compete because you contracted COVID during travel. That, I mean, is different to go to games and get injured, but to not be able to compete because you managed somehow to contract COVID during travel, that is something that we really want to make sure we avoid. So I hate to repeat, but we've got to make sure we maintain those strict protocols. It's an absolute must for certain.
Yeah, I thought I would ask this since the treatment assessment of athletes etc. Now during the pandemic is somehow similar to before. I mean, athletes get injured etc. I noticed that a lot of athletes you see tend to come to you when they are injured and badly injured in many instances. Is that the ideal situation? And what advice do you give some of these athletes though in terms of just managing their bodies before they get to you and after they leave your room?
I think you'll find the professional athletes for sure, they will come for every niggle. If they wake up and their head is hurting a little bit more than it normally does, they're gonna come and say, "Listen, something ain't right. Help me figure this out."
Yeah.
But generally, yes, athletes don't like to be injured. They don't like to, be away from training. So they will generally wait until it's really bad. No, I always encourage athletes generally to focus on their recovery. And recovery is at every single thing that they do between the time that they last finish training to the time that they train again or compete again. So that could be what they eat, what they drink, their sleep, what methods they use in terms of maybe massage, ice baths, whatever it is, foam rolling, all of these things. And I think recovery is underutilized, or it's taken for granted a lot, but that is what really keeps your body going, allows you to be able to be fresh and prepared for the next training session, for the next competition. So recovery for sure is one of the things that I always encourage athletes to focus on, and get them to understand that it's literally every single thing that you do. So everything you eat, everything you drink, how much you sleep, what recovery methods you employ, how you stretch, how much you foam roll, like all of those fine nitty gritty details, or what hold, or what we call the one percenters, really. Those are the things that we really need to focus on in terms of preventing injury, and if it is managing a particular injury, again, making sure that it doesn't reoccur. So recovery is something that I definitely would want to highlight.
Yeah. In the Caribbean, do you find it harder to manage the let's say the senior athletes versus the junior athletes, and how much I guess what kind of effort do you have to put in with the junior ones who just want to compete and sometimes are willing to even compete no matter how injured they are because the coach is pushing them, etc., etc.?
Yeah, and I think it's funny you raise that, because like you said, those junior athletes, they're just having fun. And I mean, I'm happy that they're having fun, but we have to make sure that we teach them, the right things from a young age, because when they start to put basic things in practice from a young age, then it grows with them, and it's not so difficult then for them to implement at when they actually reach that professional level, and it helps them get to that professional level and transition a bit easier, because they might go from, oh well, I never used to stretch after practice, and now I have to stretch, I gotta go and see the physio, I gotta stretch, I gotta do all these things. But if we teach them, this is part of sport, this is part of taking care of your body. And if you want to be, you know, the next Shelly Ann, if you want to be a top footballer or whatever, whatever motivates them in their sport or whatever area they're in, then, you have to use those little things to encourage them to put things in place, and
Mhm.
also mentorship, and having some of the senior athletes pull them along and teach them things that they do, and so forth.
I always wondered what are the common injuries that you see in particular sport, or is it that it doesn't matter the sport, you're going to see these kind of injuries from our athletes, whether it's triple jump, it's going to be the knees and the hip. Is it that swimming is the shoulders, rugby is from the head to the toe?
Yeah.
Are there particular injuries that you see
No particular sports.
certain sports?
Yes, for sure. Some injuries are more common in particular sports. So in cricket, you might find a lot of back injuries, and fast bowlers, shoulder injuries. Hamstring injuries are quite common in cricketers, as well as sprinters. Rugby, like you said, could be head to toe. That could be anything from concussion right down to
Uh,
fractured, broken bones. Um, Swimming, maybe they tend to get injured less frequently, but when they do, it probably be like a shoulder injury. And yeah, the list goes on. Footballers, hamstring injuries are very common in football. And then the other sports like volleyball, netball, those hard court sports, basketball, you find a lot of knee injuries. Um, yeah, so definitely depending on the sport, there are particular injuries that you'll find more common, or particular injuries that we would look out for even sitting on the
right.
sidelines. You kind of expect and already watching to see, you know, what's
Yeah.
happening or what injuries to expect.
Yeah, I mean, I found it interesting for sport like gymnastics, where it is a lot about dislocating and the shoulder and getting it back in while doing a rotation, and it you can get injured, etc. Rugby for me is just absolutely interesting. I just think if I was a physiotherapist for a rugby team, yeah, I'd be looking out for injuries any type at any point, and then cricket. Well, we have seen several things with cricket. When you were with the Cricket West Indies women's team, what was that experience like for you, and how has things evolved in terms of professional female cricketers taking injury prevention and injury management very seriously, and rehabilitation?
Yeah, well, that was a really good experience for me. Um, Working and living day in day out with an international team, and a role that I took very seriously, because when I came into the team, they, I mean, the girls are quite professional, and they go about their business well, but I want to make sure that I implemented certain things to help them monitor their general living and sports science, introducing sports science and sports medicine principles for them. So getting them to fill out questionnaires at the beginning and the end of practice, getting them to weigh in and weigh out, getting to focus on their hydration. Again, those one percenters that you need to focus on to make sure that performance is up there, that they can get through the tour without breaking down, making sure that we minimize the injuries as much as we can. And yeah, so I think they've come a long way for sure. um it's unfortunate now that there's been such a long break because
Mhm.
of this entire pandemic, and I just hope that they are able to get back on track, because again, th- being in the West Indies and having players in different countries, it's hard to control them, and that's one of the challenges that we always had. When the players are in camp, it's great. You get them in camp for 6 to 8 weeks, everybody's on board, everybody's doing the same thing, everybody's eating the same thing, we can control what they do. When they head back home to their individual countries, individual families, individual different areas. And then, for instance, Jamaica's so big. In Barbados, yes, we can still get them together to train at the same place. But in Jamaica, no, this person lives in Spanish Town, this person lives, you know, so managing players then Jamaica, Barbados, Trinidad, Guyana, it I think that is one of the biggest challenges that we face as the sports science team between myself, physiotherapist, the strength and conditioning coach, psychologist. It's difficult, but I guess no tool using online that is a tool that has made things a little easier. But again, having everybody in the same place at the same time is always the best option, best case scenario.
And then, I mean, while you're talking, I'm thinking then this is why a lot of monitoring no individual responsibility, I probably should say. Let's start another way. The professional athletes have to be very responsible now, because you're not able to do those camps, etc. So they must take that personal responsibility in terms of stretching, in terms of working out, in terms of that the sports science aspect of it, weighing, ensuring that their weight are at a particular level, etc. You spoke about that, but how difficult is that, and do you see that being a challenge whenever we're ready to compete again, especially for let's say a Cricket West Indies women's team?
Yes, and that's another thing that we stress heavily a lot, that, it's your responsibility. We will put things in place. We will make sure that you have everything you need. We're gonna give you what you need, but at the end of the day, it's your career, it's your responsibility, and it's still the onus is still on you, the player. To get what you need to do done and to make sure that you are able to pass your fitness tests and you're able to perform, because that's what we really want as a team and as players, right?
Yeah, I fully agree with you. Do you think we fully understand the role of physiotherapist in the Caribbean, and how important that is for not just professional athletes, but certainly just athletes? And I'm talking about the sport aspect of it, because obviously physiotherapist deals with not just athletes.
Yeah, no, I do not, and it's something that still bothers me to this day. Um, I think in sports, persons are a little bit more familiar, but still there's room for improvement, because there's still um, athletes and persons that don't even know that physios exist or what we do, which is quite crazy. But yeah, I think it's an area that we in the profession have to do a lot more work in, because again, like you said, not just athletes. I mean, the professional athletes will know because they're always,
Right.
supported by a team. So they're familiar and they know. But before you get to that level, then, you still have to be taking care of yourself and managing your injuries as you progress to that level. And then for the general person in the public, I find, persons in pain, they'll always run to the doctor. Fine. Unfortunately, not all doctors refer to physio. We can help so much more than what doctors refer. And again, I think if people knew more about physiotherapy, then they could even go to the doctor and say, well, do you think physical therapy could help me with this? And they, can actually go and ask their doctor for a physiotherapy referral and then get the help they need. So it's an area that we definitely need to do a lot more work in. It's quite, I don't know what's the word to say, but yeah, I feel
Yeah.
distressed every time I think about it.
I think, Marita, that if I knew more about physiotherapists, I could have been, a top-notch professional athlete out there, because, I think I had some talent, but I didn't know everything, and I got injured. Even though you may be surprised to know this or not, that I just finished. This is probably about 4 weeks of physiotherapy and rehabilitation because of some knee injuries that have been persistent all these years.
Right.
And I'm feeling much better now. Thanks to Dr. Lyons and Matthew before that, etc., who have been working on me. So I think you're right. Every now and again I have this discussion about our appreciation for physiotherapists and how much more we can do in terms of just sports medicine in the Caribbean.
Yeah.
I think we're just woefully short in both our understanding and usage of sports medicine. I think that's my opinion. I mean, I know little about sports medicine, but just looking around and what exists outside of the Caribbean, and then just how we use it also, because when our athletes travel sometimes they're like, whoa, I could do this. Yes, you could. Your physiotherapist can actually do it.
Exactly. Yeah. And then, when they have that moment, they're like, oh my goodness, I wish I knew this before. So it's like, why can't we get that happening, that like bulk start happening a bit earlier on? But it's something that, I'm dedicated to working on, and setups like this, having these podcasts, being able to engage with different professionals and getting the message out there is what we really need to do a lot more of.
Yeah. No, I fully agree with you on that, and hopefully, more and more and more people will talk about it. So we have been discussing a lot about physiotherapy and your role in it. You have decided to open your own practice, and
Mhm.
which is not necessarily that it's not unique to the Caribbean, but not many people are willing to do that. Why did you decide to do this? How has it been going for you, especially in the midst of this pandemic? And what do you expect certainly from it? Talk to us a little bit more about that.
Yeah, well, to be honest, it's always been something that I've wanted and seen myself doing. So it was just about, you know, getting to that point where I felt ready. And once I reached that stage, then, I jumped right in. And believe it or not, I was into about 2 months or so into working before this pandemic came around, and it was nerve-wracking to say the least. I mean, I didn't know what to expect. I think we all went through that initially. We weren't sure what this thing was, what was going to be the outcome after. And then coupling with that, the fact that this is a new business, I was already dealing with adjusting to, being an entrepreneur, having my own business, building this business, and then there's a massive cloud of uncertainty. It definitely caused me to pivot, and I did not stop working throughout the pandemic. When we went into our first lockdown here in Barbados in, I think it was the end of March, April, I decided, you know what? Well, I'm going to start doing virtual physiotherapy. I'd never done it before. Didn't know how patients were going to adjust to it. Didn't know if patients would want to do it. But I said, you know what? I have to keep going. I have to keep doing something. I have to try something. And believe it or not, that went pretty well. And because we're essential service, I was still able to do a couple home visits for persons who had, severe pain and needed someone to come in to their home. So I was still able to do that. I was still able to work, which I was very thankful for. And then surprisingly, when things opened back up and I was able to get back into the clinic, once I said I was open, then persons started coming. And that's another thing that I was unsure about because, this is a new world now. Everybody's has to wear masks. This thing is still about and about. And I wasn't sure how people would feel in terms of coming out into the clinic. I feel like persons are already hesitant to deal with their pain and injuries. Um, to come out now during a pandemic, I figured, persons probably won't. Thankfully, things, I mean, definitely not as hectic as prior to the whole pandemic, but things gradually built up, and I can say that I had a decent first year despite
Mhm.
the confusion, sorry. So yeah, I mean, it has its challenges for sure. There's a lot of learning taking place, a lot of hats being worn. But I am enjoying it.
Yeah, I must say, I mean, just looking on and what needs to put in place, it is a tricky time for everyone in the Caribbean, and it kind of make me wonder then, Marita, to what extent for some athletes who may have challenges already in terms of getting into your space, depending on where they live, etc., their financial background, and know this has hit them. How do they manage to afford, physiotherapy, other forms of medical treatment, etc., rehabilitation, and whether or not this will affect them. Well, not whether or not it will affect them negatively, but to what extent it will affect them in terms of their preparation, for games, for training, etc., and how soon they can return.
Yeah, I mean, like you said, that's been an issue before. And now with the pandemic, it's just, I can imagine it's quite hard for many people. In my case, I offer discounts for students, and then, if persons come to me, reach out to me and say, they need help, then I will help them as much as I can. Um, but again, some people, will be hesitant to reach out. But I think, anyone, if you're having issues, still just try to find someone to talk to. And it doesn't hurt to try to answer a question. You never know, what
Yeah.
answer you might get. Yeah.
If there is a youngster out there, Marita, I mean, we're over in the Caribbean because people from all over listen to this podcast. Apparently, what advice would you give them, who wants to get into becoming a physiotherapist? Because some may think it looks easy. I mean, they think physiotherapists just go on trips when they can
Yeah.
and have a good time in Tokyo or Australia, etc. Is that it though? Is it hard, or is look at it's as easy as it looks?
It looks glamorous, but it definitely is not glamorous. We go on those trips and we hardly get to sightsee. If you get a couple hours out, you are lucky. Most times you go from the airport to the hotel to the training facility back to the hotel, and that's about it. So definitely not as glamorous as it looks. And it is, I could almost say, you're always on call, especially on tour. If anything happens, that is you. They're going to call the physiotherapist. There's not every tour that a doctor is available. So that physiotherapist has to get up at whatever time. If that athlete woke up in the middle of the night and stumped their toe, the physio needs to respond. So definitely long days, long nights, and not nearly as glamorous as it looks. But for someone who's interested, I would say, as I said before, there's many more areas to physio than just sports. Sports is a small, 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 small section of physiotherapy. And to figure out if that's physiotherapy is really something that you want to do, I would say reach out to a physiotherapist who is in your area. See if you can do some volunteering, shadowing with them, so you get an idea of what it really entails, what job entails, and what it's really like. And then after that, you can really make a better decision on, is this something that I understand and I really want to do. And then yeah, I that's my biggest advice: to volunteer, find a mentor, someone who you can bounce out ideas off of, answer all your questions, and really decide if it's something that you want to do.
Yeah, I wanted to touch, and those are some good advice. Thanks for that. I also wanted to touch a bit on that trip thing that we were talking about earlier, in the sense that the physiotherapists who travel with teams have such a hard job to do with these teams. And it doesn't matter if it's large teams or not, but for bigger games, it becomes more difficult because the minute you leave with that team, you start working until you get back home, and it's almost like a 24-hour cycle, because when everybody else is sleeping, the physio room tend to be the one that is full, because various athletes, for whatever reason, whether they're going into competition or coming out of competition, they want to see the physio, and the physio room get knocked up all the time. People are knocking
Yep.
on the door all the time.
Yep, that's correct. And anyone who's been on tour or, travel on a team, they, that's how it is. So definitely nothing to take lightly. We're not over there living our best lives, even though, yes, we traveled and we got to another country, great, but most of the time we are working very hard. So definitely not as glamorous as it looks, but it's something that brings a lot of fulfillment, being able to assist not just athletes, but persons who have injuries, persons living in pain, be able to do things that they've wanted to do or couldn't do for months, and then being able to return to that, seeing your athletes perform at their best, seeing your athletes win, teams win, medal, is something that it makes you feel good inside. So that's, I guess, the good thing.
And if there is ever a positive I probably could think of, for those young ones, especially listening, is, if you do well, you may get a client from the group in the future, where athletes may like what you do now and may just stick with you for the future. I mean, it has. All right, listen, Marita, I want to thank you very much. Oh, before I go, let me just ask you quickly. This wasn't a question I thought of initially, but what role now? Every single frontline worker is crucial now, but what role do you think the physiotherapists play in this new normal that we're moving into, and as we try to get sports up and running in the Caribbean?
We play a very big role. Um, uh, you touched on sports, but the physiotherapists in the hospitals, I think people don't even realize that, we work directly with COVID-19 patients, and it's part of their recovery, not just while they're COVID-19 positive, but even afterwards. So the role of the physiotherapist is definitely a tremendous one, and one that we really need to highlight a bit more in terms of sport. You're seeing now teams having to identify and put persons in place to manage just COVID-19 testing, because traveling now, um, being in a bubble, athletes are being required to test at least every 5 days in most instances. And you have sometimes physios taking the lead on managing the testing of the athletes within the bubble. So yeah, it's a role that definitely is a wide ranging one, tremendous. It is yeah.
Marita, before I go,
Yeah.
help my listeners to know how they can find more about your practice and some of the services, in case they're in Barbados, or just in case you can do some work with them online. How can they know more about your practice?
Yep. So Pops, you can find us on Instagram. That's Pops underscore physio underscore 246. And that stands for Physiotherapy and Optimal Performance Services. That's the name of my business. And feel free to reach out to me on Instagram. My email and everything is listed on there. If you have any questions, I am always willing to answer, to help anyone anywhere. So feel free to find me on Instagram. That's probably the easiest place.
All right. Thank you very much. That's Marita Marshall, and she's clinical director at Physical Therapy and Optimal Performance. And you can feel free to reach out to her, get advice if needs be. I'm sure she's always here to talk with anyone who wants to listen. So, guys, on behalf of the entire production team, thanks for joining us on this episode of the Dry Face podcast, and thanks to Marita Marshall for being here with us.
Thank you so much for having me again.